Perfect. So, hello everyone. My name's Caroline, and I'm head of alumni engagement here at the University of Liverpool. So, we're delighted to be joined today by David Alexander, who's an alumnus of the university, and he today will share his journey with us since leaving Liverpool. Before we start, can I please ask that you keep your microphones on mute during the talk? And please do post any questions that you have in the chat function. And also feel free to leave your camera on throughout the talk too. And just to let you know that this talk will be recorded. So thank you for joining us today, David. And just to introduce, so David is originally from Liverpool and is now based in the northeastern US. He's had a distinguished healthcare professional and is a leader in global health policy and communications. A graduate of the BDS Dental Surgery from our university in 1975, and his career spans service as a dental officer in the Royal Navy with executive roles in healthcare and non-profit sectors, including with the FDI World Dental Federation. Dave now consults on integrating medicine and dentistry and advises healthcare startups. Today, David will offer an insight into his vast experience in healthcare communication and scientific engagement, and how an uncharted career can unfold and lead to success and happiness. So thank you, David. I was just wondering if we could start maybe by introducing yourself, sharing a brief overview of your career journey since graduating from the University of Liverpool, please.
Yeah. Thank you for your introduction, Caroline, and greetings, everybody, wherever you are in the world. Good morning, good afternoon, good evening. It's a pleasure to see you all here, and I hope in the next hour I can share some interesting things from my career that may help you in your career and the pathways ahead. As Caroline said, I started off. I'm a native of Liverpool, lived in Crosby, loved the sea very much, was very much driven by Liverpool being a seaport. My father worked in shipping. So I had a calling for the sea, greater than dentistry. But people at the time were saying, if you're going to go to sea, get something in case you don't stay at sea. And so I sort of settled on a compromise of dentistry and became a dentist in the British Navy. So I had 4.5 years doing dentistry at Liverpool. The dental school was new at the time. I can't say I had a distinguished career whatsoever. I sort of felt I scraped through. I didn't particularly enjoy it. And that was probably as much my fault as the dental school's fault. But anyhow, I did graduate. I joined the Navy and had a very interesting, unusual career in that I haven't actually done much clinical dentistry. I've been involved in sort of healthcare, around academia, around research, policy development. And as we'll talk later on, I got into industry too. So when I left dental school, I said I never want to do any studying ever again. The experience had been that sort of bad. And yet, you'll see after I went to Brunei with the Royal Navy, that had a huge impact on me, that sort of Western dentistry doesn't work or doesn't work in all communities and populations. It was quite a horrifying time for me in that Brunei at the time was an incredibly, the Sultan of Brunei was the wealthiest person in the world. There was no piece of equipment I couldn't buy for the clinic. But every morning, the waiting room was full of screaming kids, and I couldn't do anything about it. Technology wasn't going to impose health. And the penny started to drop that there's something wrong with the delivery of classic healthcare. The reparative model didn't work. So after that, I went back to the UK. I only had two years in Brunei. I had 2 years there. Both our kids were born whilst we were there. Socially and everything else, it was a wonderful experience, but work-wise, it was very, very frustrating. When I got back to the UK, the Navy got me involved in training dental hygienists, which are a sort of profession allied to dentistry, like a mid-level provider. And there's nothing like having to teach to get you to understand what you never learned yourself. And so the penny, which was sort of the sensitization I had in Brunei from that experience, beginning to teach dental hygienists, which is largely preventive rather than reparative, things began to come together to me. And I continued studying then, though I said I'd never wanted to study ever in my life again. And I got a higher degree in general dentistry, that's general practice dentistry. And then the Navy enabled me to go and study dental public health at the London Hospital Medical College, which was really when everything did come together in terms of global health. The reparative model doesn't work. Um, and that really changed my life completely. After that, um, then I was really into anti-sugar. You know, sugar causes caries. Caries is the number one disease on the planet. We've got to do something about sugar and fluoride and those sorts of things. I did research within the Royal Navy in that dentistry is provided to military personnel so they can go and do their job, fight in battle without being compromised on oral ill health. But doing a dietary survey of what the food was being fed to the military showed it was a highly cariogenic diet. And it was, this doesn't really seem to make sense. Um, so that impacted me a lot too. And to cut that story short, the British Navy didn't know what to do with me after that. So they loaned me on an exchange program to the United States Navy, which is much, much larger. It had its own dental school in Bethesda, Maryland, just opposite the National Institutes of Health. Whilst I was there enabling residents to do their research, that's their grad students, I also did my board certification in dental public health. So I became board certified in the US. We went to be in America for 2 years. We actually had 6 years with the United States Navy in Washington, D.C., which was very eye-opening to me also, seeing and the NIH there and just the whole sort of American health system and how it very differed from the British system. And certainly the attitude to public health on either side of the Atlantic was very, very different. In the UK side of the Atlantic, it was very much sort of policy and prevention. In the US side, it was more sort of execution of services and management. After those 6 years, I serendipitously met somebody in an elevator at the National Institutes of Health who happened to work for industry. And to cut a long story short, I went to work for GlaxoSmithKline as their sort of worldwide dentist, working with associations and dental schools around the world, raising awareness of various conditions that the company was interested in. It was the time they were developing Pronamel toothpaste, which was a sort of anti-erosion toothpaste rather than just an anti-caries toothpaste. So I was traveling the world actually talking about the science behind erosive tooth wear through acids in the diet and things like that. After that, 10 years of traveling around the world, I got exhausted, went to work for the FDI World Dental Federation in Geneva for 2 years, which was again another mind-blowing experience, Geneva being the sort of world capital of health policy, working alongside other major organizations, such as the World Medical Association, the International College of Congress of Nurses, the pharmacists, all those different groups, and of course the World Health Organization itself and the UN in Geneva. So it really was the world capital of health, and it really opened my eyes to sort of global health issues, and that really, oral health has been in a silo, and it's got to get out of that silo. In other words, we've got to put the mouth back in the body. Dentistry took the mouth out of the body many, many years ago. And I realized that the mouth has to be part of the body, not just that orifice that other physicians and other medical professionals look through to get to the tonsils and the pharynx. then I came back to the US and have really worked in consultancy ever since, working for big and small companies, largely in the sort of professional relations, communications in areas, engaging professionals on science to do with products and treatments and pharmacology. And here I am today. So that's really an overview of my career and who I am as David Alexander.
Oh, that's lovely. Great. Thanks, David. Just to point out, if anybody's got any questions, please do post them in the chat and then we will speak to David, pose them to David too. I was just wondering, David, you mentioned then a lot about seeing new opportunities and, different areas. So how did you go about broaching the development of those and bringing new ideas into the workplace or encouraging other professionals about these new ideas?
Yeah, it's very interesting because, when you look at that career pathway, you'd think there was some master plan. There was no master plan. That every step and every pivot of that career was sort of serendipitous, largely by chance meeting somebody um, at at a meeting, in a clinic, in a university, just having a conversation and suddenly getting that sort of light bulb going on moment that led me to another part. But I think one of the biggest issues to overcome with certainly dental professionals as opposed to other health professionals is getting them to come out of the silo of of the mouth. I've found generally working with other health professionals that they're used to working with experts in other parts of the body and are doing it every day when they refer patients. Dentistry, partly because dental schools exist separate to medical schools. So right from the start, they're brought up in different pathways. And I think there's also in dentistry somewhat of an inferiority complex that I'm not a real physician, but they're an oral physician. They're a physician of the mouth, an oral physician. And I think when they can understand that too, they are equal partners in providing healthcare, and you can't have health without oral health. So working with other professionals, other experts is just essential, and that it's something that we all need to do across the health spectrum to get the synergy that one and one make three.
Thank you. I was just wondering what do you believe is that it's essential skills for professionals in the healthcare today, and how people, our alumni can evolve as emerging leaders within the healthcare profession?
Um, I think human skills are probably the first thing, actually being able to listen to people, to understand people, to get out of your own prejudices and own thoughts, and really listen to people that we care for. And that I think once you understand the human side of it, you can be much more effective in delivering the professional and the scientific side of care. So obviously, so understanding the science is incredibly important, and that should be a given. But what is not taught well, and it's difficult to teach alongside all the technology that has to be taught in healthcare, is those humanistic skills of of actually listening and understanding and being compassionate and not always working, knowing how best to employ the science for that individual, that everybody's different and we need to understand that.
Thank you. And I was just wondering, in your current role as a consultant, what are some of the common challenges you've observed, and particularly for startups? I know that you've supported a lot of startups, and if there's any advice or any insights in this area as well, please.
Yeah, I'll just preface that with, with my time at GlaxoSmithKline. I my background's a dentist. I've had no training in marketing, communications, scientific writing. but I learned an awful lot by osmosis, being around an awful lot of people much, much smarter than myself. And I think that's a key thing in life. And it ties into sort of mentoring too, that you can learn an awful lot from really smart people, and you need to find those smart people and be around them. And then you can just soak it up by osmosis. So during my 10 years with GlaxoSmithKline, I learned a lot about marketing, about business, about communications, working with people both inside the company and all the various healthcare agencies that huge companies are fortunate enough to be able to engage and employ. So I learned a lot of skills there about doing things right and working as a team. That environment, we worked in very highly matrix teams, so they were very flat, but a team would be people of all sorts of disciplines across the entire sort of business spectrum. When you compare that with a startup, it's usually two or three people that have had a great idea and have managed to bring a product through the sort of approval process and get it ready for market. They are very dearly attached to their ideas and their concepts, and have really got their backs to the wall because every cent or penny they've got is really important. So they don't have much in the way of resources, that unlike the huge multinational companies. And so working with those people can be it can be very challenging. It's fascinating. It doesn't reward terribly well because of the situation of trying to get a product to marketplace that investors want to see success, and so money is short. But yeah, it's night and day difference. But when you do see success and a product does make it to market, and many don't, it is phenomenally rewarding, and yeah, it's very rewarding.
Great. I was just wondering, you've spoken a lot about mentorship and people around you that you've learned from. Is there anybody in particular from your career experiences that has kind of resonates with you, or someone you still think of today? Or
Yeah, today, mentoring is often much more in a sort of much more of a formalized agreement between mentor and mentee. And that can be as rewarding and as learning and as educational for the mentor as the mentee. It's very much a two-way process. Or when mentoring is done well, it's two-way. And the times I've mentored somebody that I've enjoyed it and probably learned more, I hope, from the mentee than the mentor has from me. The mentoring I'd say that I've had was, or when I look at what mentors have shaped me, um, it was never, we probably didn't even use the word mentoring, but it was a mentoring relationship as we look back on it to today. And they're just people that have inspired me, have had faith in me for whatever reason. And as I say, I've always looked to try and to try and be around smarter people than myself and learn from osmosis. But I do think in this day and age, it's critical for everybody to think in their early stages of their career to find a mentor, to establish a more formalized relation that this person is going to mentor me, and we've set some goals at the outset, rather than in my way it was more serendipitous that we sort of came along that pathway that we did. So I think it needs to be more formalized and more structured, and it can be incredibly successful and save the mentee a lot of time and a lot of effort and a lot of learning by mistakes. Not that there's anything wrong with learning by mistakes, that every successful person has made an awful lot of mistakes to get to that success.
yeah, I was just thinking, David, could you expand a bit on some of the unplanned opportunities? Because I know it's not been like a linear career for you, and you've opened up, it's been a bit unplanned, as you said, and new opportunities have come along. Have there been any mistakes or any advice for graduates to embrace those unplanned opportunities potentially, and how they've helped you?
No, I think the thing to do, the piece of advice I'd share is don't be scared of it. If you see there's a pivot coming in your career, or one is facing you because somebody's suggested it, I don't think you should be reluctant, thinking, "Oh dear, that's not for me." That's not for everybody. But I think if you're the adventurous sort of person, you grasp those opportunities, and you never know when they're going to come. But also, you need to know when one chapter closes, another one's going to open, and that too can be tough. It's like flying up on a trapeze in a circus tent, and you've sort of let go of one trapeze and you've got to catch the other. And there's usually a safety net beneath, and somehow, if you've got a good career and a good degree behind you and a good education, such as you get from a university such as Liverpool, you're going to be okay. So, grasp new opportunities. And for most people who have got that adventurous spirit to take it, it's going to be okay.
Great.
And those are the sort of opportunities that I've had. I would have never described myself as adventurous. But when, for instance, a serendipitous meeting has come about, whether I'm at a conference or something, and somebody says, "Well, why don't you do this, or why don't you do that?" It's one of those aha moments, and to take it and go for it.
Great, lovely. So you never know where the next adventure is going to be. Just take those opportunities. Yeah,
Yeah.
sounds great. I was just thinking, you mentioned, Liverpool and having that foundation of a Liverpool degree and how that stood you instead for the rest of your career. I was just wondering if you could just talk us through, why you chose Liverpool Dental School and what it was like to study there at the time, and if you have any memorable moments from your days of studying.
Yeah. That I'm from Liverpool originally. As you know, I had been away at boarding school. I actually went to school in the Isle of Man. And so, having done my education there and got A levels, I actually wanted to sort of settle in Liverpool for a while. And I just loved the seaport aspect of Liverpool. I'm a great Everton supporter, though I'm now, because of my grandchildren, a great Liverpool supporter. So there was the sport. I played rugby at Waterloo. Um, that Liverpool still has some big emotional ties to me. When you look at it as a major European seaport and the history that it's had, I'm a proud Scouser. I'm proud to have been Liverpool, and I did apply to other universities for dental school. In those days, that there were five choices you made on your ACA as form as it was then. And I looked at all the sort of northern ones, Sheffield, Leeds, and fortunately, though I didn't get the A levels that were required, Liverpool did accept me. And I probably, looking back, I should have done much better in my time at dental school than what I did. But I also feel that it was the circumstances of how education was in those days. The education, or teaching and learning, was meant to be difficult. The faculty, the teachers were not terribly helpful. It had sort of that attitude. It had been tough for me, so it's okay if it's tough for you. And I really hope those attitudes have gone from UK universities and dental schools in particular. They have in many schools around the world, where it's a much more student supportive, student success environment. So yeah, so that was Liverpool. Really, I needed some time at home. I loved the seaport right from when I was a child of 3 or 4. My father used to walk me around the docks on Saturday mornings and things, and it was just sort of an amazing experience looking at ships that had come from all over the world that were here in Liverpool. And maybe I didn't know it, but maybe that planted a seed that sprouted later on that got me so interested in global health and those sorts of things, that it's not just the sort of health that I was originally taught in my BDS course.
Lovely, thank you. Yes, definitely a lot more supportive in nature or courses in the university now, so that's interesting to hear. And
Yeah, yeah.
yeah, Sportsman's definitely, as you can see from the colour of my
The
top as
world
well,
has changed.
change
The world
allegiances
has, yeah,
and yeah, definitely a strong sports and culture still in the city
yeah.
too. So just as you were talking then about your student days, are there any tips that you would share for our students and potentially our new recent graduates about to finish the courses and go into the world of work, and yeah, any key takeaways that you would like them to take from this?
Yeah, I think one interesting point I'll make in knowing both about the UK education system and the US system. Um, Professional degrees, medicine and dentistry on this side of the Atlantic are second degrees, they're doctoral degrees. You have to have a bachelor's degree to go into it, where in the UK and the sort of countries that sort of developed that shared that same system, that medicine and dentistry are first degrees. I think one of the advantages of the second degree is that by the time you graduate and qualify, you're 4 years older. So you're 25, 26, where I think I graduated when I was 22. And again, when it comes to that human side of it, the caring of people and the understanding people, communicating with people, um, that age difference makes a huge difference. So I think the advice that I would give people graduating out of the UK system, that though you've got all the clinical skills, the first things that you need to develop are those more on the humanistic side of life, that will set you up as a much better healthcare professional, providing sort of greater care. The technology, the science is one thing, but it's that caring approach that it's difficult to teach when there's all the other technology that's got to be taught too. And so I think a thing to often focus on once you've got out of your professional school is those sort of humanistic caring side of life.
Lovely, thank you. I think what a lot's coming across is the very humanistic element, and I was just thinking about like you as a person and your family. How have you managed such a varied global career, and what's the importance of work-life balance been to you, and any advice in this area too?
No, I've been very fortunate with my family that have been very willing to follow me wherever we've been. As I said before, both my children were born in Brunei. They live here in the US with me now. They're married. We have grandchildren here. So I've been very lucky with a supportive family that have been ready to move as moves have come along, whether it be Brunei, Geneva, Washington, and now the New York area, or all the places across the UK. I lived in obviously in a military career. You don't spend your life in one place. That every 2 years we were uprooted between Plymouth and Portsmouth and London and around the UK. So from that point of view, again, I've been very lucky. And yeah, that if you, yeah, I'll leave it at that. I've been lucky. I don't know what the secret sauce is to give advice on that. I think it's something that happens or it doesn't. Again, it's a serendipitous thing.
Yeah. Great, thanks, David. I'll now hand over to our volunteer officer, Vic, who has joined us today. So she's been manning the chat, so she'll pose some questions to you, David, from our audience.
Okay.
And yeah, thank you very much.
Great.
Spin around. Lovely, just a little spin around there. Thank you, David, so much for sharing your story there. It was really insightful and interesting. And we have had a couple of questions in the chat. So
Yeah.
I'm not necessarily going to pick these in order of how they've come through. I'm going to try and build a bit of a narrative with them. So we have one really great question here from Lawrence, who asks for a little bit more detail as to what it was like to have a healthcare profession in the forces. Did you have to go through any integrated naval training? And did you learn anything new or different in relation to dental health to better support your role within the armed forces? So if you could just touch a little bit more on your experiences there.
Yeah, indeed. So when I joined the Navy for my last 2 years at Liverpool, that I had what was a naval cadetship scheme. And on being accepted into that, I had a 2-week course at the Dartmouth Naval College, which was sort of teach you how to wear your uniform and sort of basis aspects of naval life. And then on graduation, there was a longer course that got into other aspects of being an officer in the military. There was nothing ever at the start taught about sort of oral health care within the military. It sort of wasn't really it wasn't really a sort of major priority that that you're caring for people so they can actually go and fight in battle and not be compromised on the grounds of oral ill health. Mentioning that, the reason the National Institute of Dental and Craniofacial Research was set up here in the United States, that's part of the NIH program, was because the number of recruits that were failed during World War II to be recruited into the US military, that the US Congress, after the war, signed this act creating the National Institutes of Dental and Craniofacial Research to look into oral ill health. However, later on in my naval career, when I started that sort of research looking into the public health aspects, and certainly not so much the reparative model, but the preventive model, one of the studies I did was sugar consumption, as I mentioned before. And actually just looking at that we saw that military dental services were high in reparative work and that there was more restorations placed in the same age group as military people as civilian people, because they were seeing the dentist every 12 months, some 6 months. And so the more often you see a dentist, the more likely you've got of getting restorations and things. And so we tried to shift it so care could be prioritized early on so that small lesions, small matters could be treated preventively rather than reparatively. Because one of the greatest issues of oral pain is failing restorations. Dentistry fails. Dentistry will inevitably fail in terms of its restorative thing, that when we put a restoration in the mouth, one day it's going to fail. It's got a limited life of 5 or 10 years. So there's inbuilt obsolescence there. If you don't have to place the restoration, that person is going to be much better off.
Yeah. And actually, you're touching there on sort of restorative versus preventative comes on to the next question to a degree. So we've got Zanab asking, she herself is an overseas trained dentist about to begin a PhD in dental public health. And they're keen to hear your thoughts on expanding knowledge and skill set during this journey. So she asks, based on your experience, how can someone incorporate global dental public health expertise into their PhD research? So big question, but if there's anything you think you can share to enhance their PhD journey.
Yeah, that's fascinating. And Yeah, I applaud you for the pathway you've taken. Um, I think in sort of global health, it's a very interesting time with the UN and WHO at the moment. Finally, in 2021, the WHO created a global strategy and action plan for oral health. Um, we've been working and pushing for this for a long, long time. That oral health had been sort of sidelined and sidelined by really the infectious diseases rather than the non-communicable diseases. And the major non-communicable diseases, heart disease, cancer, diabetes, had the resources and noise to begin to get accepted that the balance of power between infectious diseases and non-communicable diseases needed to change. Oral diseases are part of the non-communicable diseases, and yet dentistry or oral health was getting left behind. It's now caught up. In the late in 2019, there was a declaration about universal healthcare. Oral diseases got mentioned for the first time in WHO language for a long, long time, and led eventually to this action plan. It's very easy for government bodies to issue action plans and strategies. What I would suggest for your PhD, you look at how countries adopt those strategies. That the WHO can put a strategy out. It's up to each individual nation to decide whether they're going to adopt that, what parts of it they have. And I would suggest that a good area of PhD research that would be very valuable is looking at how that can be monitored and tracked, whether it be in your own country or the country you're studying in, or a basket of low middle income countries or higher countries, or the contrast like that. So I think that's an important thing. And then, or to just take certain policies and see how they can be advanced. One of the recommendations is that NGOs and civil society organizations need to take a greater role in the development of policy. I think a PhD looking at that is how better civil society, that's associations, people representing the public, can actually take part in policy. So that's my suggestions for a PhD. But I'd also be very happy to connect and talk offline with you further, or to put you in contact with people that would be able to maybe give you better advice than what I can.
Lovely. Thank you for that very generous response there, David. Scrolling back up to one of the earlier questions, you did touch on this briefly, but if we can potentially develop slightly. Rachel asks, can you tell us about the biggest challenge you faced in your career and how you overcame it? So you touched on a couple of challenges, but what's the biggest one?
Wow. Probably graduating in Liverpool. I never thought I was going to. I mean, that doing finals and waiting for them to read the results out. You think, oh, what if I don't pass? What's going to happen? And I'd got this commitment with the Navy. What are they going to think of me? Um, so that perhaps wasn't a challenge, but it was one of the biggest sort of terrible moments of my life. Other challenges, I don't know, they're uh, hard to really enumerate. What would be the hardest? Yeah, that's really difficult. I think work-wise, I'm very keen on that dentistry should be integrated into medicine, and it's not for all sorts of reasons. Payment systems are different, associations are different. There's dental schools here in the US that are 50 miles from the medical campus. Well, how can you work as a healthcare professional integrated when there's all those differences going on? But I find when I try and a challenge for medical dental integration is medical people are ready for it and understand it and sort of say, why not? It's dental people, dental professionals that sort of want to stay in their silo. And as I say, that if they do that, they will be looked upon as the mouth mechanic rather than the oral physician, where they need to see themselves as part of the overall medical team. The public expect you to be the same. We're all healthcare professionals with white coats and things like that. So one of the challenges I find most of all is actually communicating with dental people why there should be closer relationships between medicine and dentistry. And after all, it's one body. You can't have health without oral health. That we've got to work together, and dentistry needs to get out of its silo and be happy to do that. One of the issues behind that is many dental associations are essentially trade unions. And I think if you go to the British Dental Association website, it will tell you it is the trade union. So how can that enable the integration into broader healthcare that if it's only going to represent the sort of better interests of its members and its professionals without being more open-minded?
Yeah, perfect. Thank you, David. I will be very honest to the other two questions in the chat. I don't believe David is best placed to answer these questions around balancing being a dentistry professor. David has not worked in academia. His career has been very much in the Navy and in pharmaceuticals. So I apologise to skip that question, but I will. But if you'd like to get in touch with us at the alumni office, we can direct you to our Liverpool Dental Alumni Association, and they may have better contacts there that we can connect you with. And similarly to the gentleman who's posted a question around job hunting as an engineer, again, I'm afraid David's background is not in engineering, but if you'd like to get in touch with us at the alumni office, we'd be happy to provide some guidance on career support for recent graduates. So thank you for asking your questions, but please do.
Victoria, I'd be happy to comment on that
Sure.
professor question. I am actually an adjunct professor at NYU. New York University is the...
Oh, I apologize.
No, don't worry. I do very little there, but you probably, the questioner probably saw in my my bio that I do hold what's called an adjunct position, an adjunct professorship. In UK, I think we used to call them honorary professors.
Yeah.
Yeah. And I have spent a lot of time in dental schools around the world. Though not in a full-time teaching capacity, but I do think it's important that a large proportion of dental teaching staff do have a background in everyday general practice or specialty practice that are outside the walls of the dental school, because the professors are the role models for the students. And role models to me, it's a very important thing. And when I try and look back in my own career, certainly in my time at dental school, I can't think of a role model of somebody that I want to be like that. But I think it's important now that a dental school academic staff is well balanced with people that are from outside the walls of the school than inside the walls of the school. And there's a trend here in one or two schools in the USA that now they're creating this sort of dental school without walls. The clinical work is all done in the community, not in the dental hospital, as would be the case in Liverpool. So the students are learning more from their academic staff, professors and such like, that are actually working in the environment that most students, when they graduate, will be working in, and therefore they can play that greater role model. The professor can be more the role model rather than the academic, esoteric sort of professor that we often think about.
Yeah. Thank you. So I suppose, yes, in answer to that question, it is possible to juggle a little bit of a university role alongside a career, but it's thinking what that
professor
commitment looks like, if you are acting in that role, thinking
Yeah,
about
and also that in any academic role that there are many academicians. It's a good American word. There are many academicians or academics, as we'd say in the UK, that are not sort of student facing because they're doing research, um, and working in policy and working in other areas than just academia teaching students or clinical work. So there's not sort of one particular professorial model. So it's fine that we need people that are deep into research, whether it be basic research or translational research or disease research. Yeah.
Yeah. Lovely, thank you. Well, that brings us to the end of our Q&A. Unless anybody has got a question they would like to ask, you can either type it quickly or turn on your mic to ask David. But if that is all of the questions for today's session, then I'm sure we'll all agree that was hugely insightful. And we thank David very much for sharing his time with us today. It's great to hear how your journey has taken you all around the world. And as you say, you've learnt by osmosis along the way. So thank you very much, David.
Can I just leave a final thought?
Yes, please do.
This is about dental diseases, and I hope the dental people that are here will know this, but for the broader audience, that in terms of the global burden of disease, untreated dental decay in adults is the #1 disease on the planet. And we know it's largely preventable. And that we also know that oral diseases are a major cost on society, in that children don't get to school because of dental disease. Children who have dental disease don't grow as fast as others. And that untreated gum disease is like the 6th most common disease on the planet too. And the indirect costs of those diseases rank oral diseases amongst the indirect costs of the 10 leading causes of death worldwide. So oral diseases are not a minor thing. It's not just a few holes in teeth. It really is a major issue for us all on this planet. Thank you.
Yeah, no, thank you. Again, apologies, nature of Zoom. When we end this call, it will boot us all out. So thank you once again from Caroline and from myself. It's been lovely to chat with you today. There's some lovely comments, many messages of thanks for you, David, in the chat. So yeah, thank you everybody for joining us for the hour. It's been really interesting, and I shall let Russell end the call now. So thank you very much, everybody.